Okay. SPT, information gathering, communication with the patient safety application, communication with the police, you testify in the gynae OPD. You're about to see Linda Grace, 25-year-old woman with complaints of dyspareunia and unable to get intimate with her partner. She has seen the GP a couple of times with the same complaints. The last be 2 weeks back. Following is a GP referred to you for the same. Okay, so this is superficial dyspareunia. This is SPT. Okay. Okay, so we will be asking about the sexual. Only one page, right, sir? I would like to see Mrs. Linda Grace at complaints of vaginismus. Okay. I have seen her multiple times. This problem has been there for 3 years and more since last 6 months. She has been seeing the sex therapist for relaxation exercises, but it has not.
Time
Then
starts.
okay. Hello, I am Dr. Sugita, one of the doctors in the gynae OPD. May I confirm your name and age, please?
Doctor, I'm Linda, 25 years, doctor.
Can I call you Linda?
Yeah, yeah.
Linda, I can gather from your GP notes that you are having some problem with your sexual life. I'm so sorry to say. And you're here to discuss about your management options. Am I right?
Yes, doctor. Yes, it's right that, there is some issue about my sex life, and somehow I feel that I'm not able to satisfy my partner. And with this happening almost maybe 1.5 years back. Basically, I have a kid of 3 years now. But I went to GP also, and I searched on the net also some treatment if I could do and all. And no, but nothing has worked, doctor. He suggested me some sex therapy and referred me to some therapist also, but nothing is working out, doctor. Can you please tell me what to do, doctor?
Well, I do acknowledge all your concerns. I will be addressing them in a while. Before that, I would like to ask you a few more questions to know more about you. Some of my questions might be very intrusive. Please don't mind me asking. It is important for me to know more about your sexual life so that I can come to a mutually agreed shared care plan in the end. I will also give you some patient information leaflets. I will involve my consultant in your care, and I will also write back to the GP. Is that okay?
Yes, doctor. Yes.
So, can you tell me more in detail about your concerns?
Uh, um, Doctor, actually, there is a lot of pain when my partner is going inside. No, there is a lot of pain down below, and I am not able to tolerate that. That's the issue. And now I feel that really I'm not able to satisfy him.
Okay, is this pain present at other times also?
No, no, it's mainly, actually, there is a lot of stress and tension nowadays, last 6 months, because when it comes to cohabitation and sleeping together, it creates a tension for me, doctor, because I'm not able to tolerate him nowadays.
All right. Other than during the time of sex activity, when you're just like sitting on the chair or when you're walking or at the thought of sex, do you have any pain?
No, doctor, no, 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 no,
And is there any abnormal discharge from down below?
no, doctor, no.
Um, how much would you grade your pain?
Doctor, as such, normally I'm able to do my work and everything. I'm comfortable. But it's when my partner starts the sex, no, at that time only there is a pain, and uh, at certain point I cannot tolerate. That's the thing. It's
So
so
sorry.
severe. It's very severe at that time.
I'm really so sorry to hear this. And is it putting any strain on your relationship?
Yes, doctor, I do feel that we are, it may happen that because of this, and initially things were quite okay. I have got a kid of 3 years now.
And can you tell me about your period cycle? Is it regular?
Yeah, yeah, my cycles are very regular, doctor.
When was the last?
It was a last week, doctor.
Any contraceptives you've been using?
No, no,
Any sexually transmitted infections in the past?
no.
How about your smears?
Smears are normal, doctor.
And do you feel any pain while taking smears?
No, it was minimal. Yeah, that time also there was a pain.
All right. You are using any tampons or pads? usually.
Pads, doctor. Pads, pads.
And any allergies?
No, doctor.
Can you tell me about your previous delivery?
Yeah, I had normal delivery, doctor. I have got Jack, my son. He's 3 years now.
Any sutures were done down below?
Yes,
Af-
yes. There were stitches.
And was it, did it heal well, or how was your recovery after that?
Yeah, it was recovery was quite good. In fact, after that, I started having my job also quite regularly, maybe after 1 month.
All right. And did you have any pain at your suture site after that?
No, 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 doctor, no, doctor.
Okay. And do you feel any lump or any raised edges down below?
No, 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 no.
Okay. Any other medical conditions?
No, no, doctor.
Any surgeries in the past?
No.
Pardon me to ask, do you smoke?
Yes.
How many cigarettes per day?
Around 5 to 6 cigarettes per day, doctor.
Well, so smoking is injurious to your health, to your overall health. If you wish, I can put you in touch with the NHS Stop Smoking Services.
Yeah, yeah, I'll think about it, doctor.
Any alcohol or recreational drugs?
Yes, alcohol I do drink, doctor.
May I know how much?
At least twice a week, doctor. 4 to 5.
Okay. If you wish, I can put you in touch with the NHS Stop Alcohol Services as well.
Okay, doctor.
And how's your support at home?
Yeah, my partner is okay, doctor. In fact, now I don't know because I'm not able to satisfy him. So I'm really
So,
worried about my relationships also.
and how is your how was your mood lately?
Yeah, quite okay, doctor.
All right. What is your BMI or height to weight ratio?
Uh, it's 24, doctor.
Okay, thanks for all these informations you have shared. Now, coming to your concern, so you are now 25 years old and you have one child delivered normally 3 years back, and you're having this pain while having intercourse for past 2 year for past 2 years,
Yeah.
uh, and it has increased recently for 6 months. So we call this as secondary vaginismus. Have you heard about it?
Yeah, GP was telling something like that, doctor, that some thing is there down below, the muscles are tight or something like that.
Exactly. So this is happening because of the involuntary contractions of the muscles of your genitalia down below. They contract at times when they are stimulated, as in a case of having intercourse. They get stimulated and they contract more than normal, which is what is happening with you. So we do have some treatment options for this. One is the non-medical approach or the conservative measures, where you can go for this talking therapy, knowing more about your anatomy, and the sex therapist can counsel you how to go about it. As you said, it is not working for you. Am I right? Did you go for all
Yeah,
these
yeah.
sessions?
I did try a few sessions. Lastly, because there was no effect, so I didn't attend further sessions. That's the thing.
And there are also some pelvic relaxation exercises which the physiotherapist can teach you. So that will also help, like yoga or relaxation of your pelvic muscle floors will help. And there are, apart from that, we do also have some medications. That is, if you're very much stressed, you can take some antidepressant medications. They do have some side effects like drowsiness or some nausea and vomiting can be there, but however it can, once your stress is reduced, you can try taking them during your intercourse times. Okay. Apart from that, I just want to examine you in the presence of the chaperone, if you would allow me, so that I can assess your general well-being
Yeah,
down below.
doctor, GP has examined me and he has told me that I need to show you this.
Sorry, no mask, no distance. Levator spasm. Okay. So let me confirm this examination findings of the GP if you would allow me.
Okay.
Is
Yeah, doctor. Yeah, that's fine,
so,
doctor.
from your examination, the muscles down below is actually contracting more. So to help with this, we can give you some injections locally, called Botox injections, which will relax those muscles. And the exercise training and relaxation exercises for the muscles will definitely help with for you in this case.
Yes, doctor. Yes, yes.
um, so can I, if you wish, I can now put you in touch with the counselors, the physiotherapists, to learn about the exercises. And if it is not working after a few sessions,
Time
then
is up.
I
Time is up.
okay, thank you.
Doctor, what do you feel about this station?
I was not very happy. I thought it will be like secondary vaginismus because of this delivery episiotomy, maybe there, Fenton's procedures, I can speak, I thought. But levator antispasm more than Botox, I don't know what to tell.
Doctor, unfortunately, this station is not up to the mark. This station had a hidden agenda of domestic violence.
Oh,
If
wow.
you notice the way she was telling, she was giving you the hint, the things are not working out. My
Mm-hmm.
partner, I'm not able to satisfy my partner, and she's
Oh,
not going beyond a certain limit.
mm-hmm.
You did mention that, doctor, what you said, that there will be certain questions which are introduced in nature. So that is the, blanket statement which every candidate is going to mention. Beyond that, at certain places, the confidentiality is important. If you feel at certain places, take the clues of the body language, take the clues of the words which the role player is repeating again and again. Okay,
Mm.
here, if you would have asked, why do you feel that there will be any relationship issues, she will definitely tell you if you assure the confidentiality. You ask
Mm.
him that there are certain patients, or there are certain women who come to us with some form of violence. So I'm just asking you because it is a part of our gathering of the information so that we can help these candidates. Okay, so if you begin in that particular way, at least a simple question, you will get more clues whether you want to go ahead. Here she is bitten by her husband. Initially she thought that it's because of the relationship issues, but because of her problem, and the problem is main the domestic violence. So
Oh,
the station completely on the domestic violence. The vaginism, it actually, management of vaginisms is very short, whatever you have spoken, that is the thing. But here almost 3 minutes of 2 to 3 minutes will go on the domestic violence. Okay, so I'll
okay.
just go ahead with the key, because vaginisms you have covered. Okay, but you have not touched upon the agenda of this station. Okay, so patient safety, these were the domain which you were
Sir,
supposed
how
to.
to find
Yeah.
out the hidden agenda, sir?
Yeah, basically, it is actually eye to eye contact of the role player. And there are certain things like, here, as I told you, that she's telling repeatedly that she is not able to satisfy the partner. So, why she feels, and when she says that she is a smoker, she is alcoholic, you think about certain things are, happening in the family. Okay, especially if your role player is asylum seeker. Okay, if there is a migration of the role player, and use of alcohol, smoking, these are the factors which you need to think about certain things. So just don't go straight ahead, way ahead, that I'll refer you to that. Okay, and never forget the reference for the counseling in these patients. Okay, and if you just say that, I assure you the confidentiality, if you have anything to be shared with me, I ensure that there will be help which will be provided. 1 in 4 patients do have some kind of violence. So if you have anything to be told to us, you are welcome. Okay. So just I don't know, are you able to see the presentation or no?
No, sir.
Just a moment.
So, when I asked that, how is your support at home?
10 minutes. Yeah, yeah. So that time also she was not very sure. That time also she was not very sure. She was saying that, oh, my partner was supportive, but nowadays I am not able to satisfy. That was the sentence which she has used 3 times.
Okay.
Okay. So uh, now you can see the slide.
Yes, sir.
Yeah. So domains were patient safety, confirmation of the name and age, explore concerns, taking into confidence, referring to social and safeguarding services, ensuring child safeguarding services. And another thing is that she is saying that she has got one child, one child. That also, something related to the child is coming in between. You need to think about this safeguarding and all those things. Just keep in mind when you are having this station. Okay, communication with the patient, empathy is required here. I felt quite okay, but you never touch that agenda. But otherwise you were quite good in empathy. Okay. Explore type of abuse, use of weapons, sexual coercion, applied clinical knowledge. Especially if you tell that, if you take the this lady in confidence, no, she told you that she is under stress when it is a issue that she's for going to the bed. Okay. And that time the partner is hitting her. Okay. And n number of things are there, etc. Then you need to ask about the weapons and all those things. Okay. So when you get something, you go ahead for the next thing. Applied clinical knowledge, explanation, talking about domestic violence, management of the vaginisms. So that was the thing which was expected here. Vaginisms, MDT, counselors referral, then psychosexual therapy, relaxation therapy, pelvic floor exercises. This you have covered. Vaginal trainers you did not mention, but there is a role of the vaginal trainers. Okay. Then domestic violence escape plan you need to discuss. If you do not feel safe at home, go to the friend's place or family or refugee accommodation. She can go. Refer to adult safeguarding services. Keep important documents, clothes, money, spare car keys in a bag away from your partner in a safe place in case of emergency. Domestic violence 24 hours helpline you need to suggest. Then support groups for women aid, refugee can help with money, accommodation and legal aid. Okay. So rest of the template was quite good that you have introduced, greeted. The agenda was quite okay. Open-minded questions, open-ended questions. Rest of the history was quite good, but you need to take the certain clues here. Okay, examination that you offered late. Okay, that is why the slide was shown to you at the end. Okay. I'll be very gentle and stop if it's painful. Condition is called as vaginisms, wherein there is involuntary contraction of the vaginal muscles. When there is a penetration, it could be due to anxiety, fear, scarring. As there is no other cause, is there anything you want to tell me about? Okay, so there is findings are also normal. Okay, as there is no other cause, there is anything which you want to, this also you can mention. Whatever we speak will be confidential. Whatever we speak will remain between us unless your safety or your children's safety is at stake. 1 in 4 women go through what you are going through. We are here to help you and ensure your safety. Suspect hidden agenda when the role player answers are short, avoiding eye contact. Okay, so these are the clues which you should take. Okay, so this particular hidden agenda you need to think about. Okay, and try to explore. Just one question, will change the direction of your station completely. Okay. And sometimes it happens, you feel that your station has gone, you have spoken, covered 10 minutes,
Yeah,
but if you have not touched upon the certain
yeah.
areas, like in the first thing also, I was expecting I'm distressed. I'm
Mm.
sort of whether she's landing up in a depression or something like that, because of her cosmesis is going to be very, very important. And in first station also, I'm not sure whether you mentioned about I would like to examine in presence of chaperone. Okay, here you did mention, because that time it clicked to me that in first station whether I did not had mention in the first station. Okay,
Yeah.
so that is the thing. So we have finished two station.